All right, everyone, welcome back to part 4 of our appendicular skeleton lecture, and this will be our last part. And in this part, we're going to talk about the bones of our lower limb. So specifically looking at the bones of the leg, so that being, or the bones of the thigh and the leg, so that being the femur, tibia, and fibula. And then we will get down into talking about the bones of the feet and some associated structures down there. So now, anatomically, when you divide the lower limb, you call the region between the hip and the knee, you call this the thigh region. And then the leg proper is the region between the knee and the ankle, and then you get into the foot more distally. All right. So keep that in mind as we talk about these. So if we look at the first bone of the lower limb, apart from the pelvis, we can see that we have our femur. Now, the femur is the largest bone in the body. It is also the most strong bone, so it's able to bear the most weight and be able to withstand this weight as well. Now, in our bodies, our femur is not perfectly perpendicular, perfectly parallel to the orientation of our body. So we stand directly upright. We stand upright on two legs. The femur is not perfectly parallel to that. It's not perfectly upright. It is slightly convergent. All right. So it is slightly moving in just ever so slightly, and not enough to where we can tell from the surface, but whenever you dissect down and you look at a model or an image like this, you can see that the hip is, or the femur is slightly converging in to toward the knee. And so what this does is this helps to bring the body's weight, the center of gravity, underneath the body, and so to help with balance. If we had the hip be more straight, we would have more of a kind of side to side wobble whenever we walk, as opposed to this more convergent femur here. All right. So the first thing that we can look at is near the head. So the head is the ball of the ball and socket joint that makes up the hip. And there's this region known as the fovea capitis. And this contains a ligament, and the name of the ligament is the ligament of the head of the femur. That is what it is called. It's sometimes also referred to as the ligamentum teres. But this helps to attach and stabilize the head of the femur, and so the femur itself, in the acetabulum. Okay. All right, we can also see that we have trochanters. These trochanters are large projections. So we've talked about tuberosities and whatnot, but a trochanter is a very large projection of bone, and we really only find them on the femur. And we have a greater and we have a lesser. These allow for the attachment of muscles that are going to be moving our hips. So we have a muscle known as the iliopsoas muscle, which is really two muscles kind of combined into one that help with hip flexion. So bringing your hip up. And then you also have external or lateral hip rotators that can attach down to this lesser trochanter and pull and twist the hip, so as if you were twisting your leg outwards. All right. We also have something known as the linea aspera, and this is a small but long raised region of bone, and this allows for the attachment of several muscles, including the muscles of our medial thigh compartment. So what are called our adductors that we'll look at whenever we do muscles in lab. The adductors help to adduct. So adduction is the process of bringing a body part, or the leg in this case, in closer to midline. So you're adding it back. So it's adduction. And so our adductors include the muscles of the medial thigh compartment, so the medial inner part of the thigh. These all attach somewhere up here to the os coxa, so somewhere around the ischium and the pubis, and then they also run down and they attach along this linea aspera on the posterior aspect of the femur. We then have condyles. A condyle is a smooth, rounded portion of a bone, and we have these lateral and medial condyles that articulate with the tibia to form our knee joint. And so this is what helps form our tibiofemoral joint, or our actual knee joint. And you have a lateral and a medial. The lateral is more laterally located. It's closer to the side of the fibula, whereas the medial is closer to the side of the medial aspect of the tibia. Right. And then we have the patella itself. So the patella is not the femur, but it is a bone that is associated with the femur. Now, the patella, as we typically call it, the kneecap, right? So it is what's referred to as a sesamoid bone. And a sesamoid bone is a bone that develops within a tendon, right? So your patella, if you kind of straighten your leg out and relax it, you can actually push and move your patella around, but it stays relatively localized, right? It's not going to slide all the way around your knee or anything like that. That's because it's engulfed within what's called the quadriceps femoris tendon. So if you look at this small image down to the left, you can see the circle here. Here's the area where we would have our tendon, the patella, and you can see the outline of the patella here. It is engulfed, or it is enclosed or encased within this quadriceps femoris tendon. And what the patella really does is it helps to straighten out the line of force, or the line of action, coming from our quadriceps femoris muscle group. So the muscle group may be coming somewhat, if you can see my arrow, kind of coming in at an angle like this, following the femur, so coming in at an angle. And when it hits the quadriceps femoris tendon, it then engulfs the patella, and then it straightens it out. So in other words, whenever we extend our knee, or we extend the leg at the knee, it goes straight out, and it's not going out at an angle. And that's in part due to this nice patella here. Okay. All right. So if we move now just distal to the femur, we can get to one of the first bones of our leg. So the region between the knee and the ankle. And this is our tibia. All right. So I emphasize here, this is not the tibula. Okay. You will see in clinical settings, and you'll hear your friends, and you may even say it, they will say the tibula. It is not the tibula. It has never been the tibula, nor will it ever be the tibula. It is the tibia, right? So we have a fibula, but not a tibula. So please don't say tibula, say tibia, right? This is the second strongest bone in the body. This is what we typically think of as our shin, right? So if you slam your shin on a door or something on a wall, you are hitting your tibia, all right? So just like with the femur, we also have condyles. We have a smooth, kind of rounded region of a bone that articulates with the condyles of the femur to help form our tibiofemoral joint, so to form the knee joint. We also have this region known as the intercondylar eminence. So intercondylar, that just means between the condyles, so between the lateral and the medial condyle of the tibia here. Eminence, if you address somebody as your eminence, it's a sign of royalty, right? And what do people who are royal wear? They wear a crown. And so this little region of bone projects upward and somewhat looks like maybe something like a crown. And so it's named the intercondylar eminence. This is where we have our anterior and posterior cruciate ligaments, so your ACL and PCL. This is where these attach as they run up from the femur, run up from the tibia and attach to the inside of the femur. We'll talk more about those whenever we do things in lab and whenever we get to later lectures. All right, you also have the tibial tuberosity. This is a raised region of bone that's very easy to feel. So if you feel your kneecap, you feel your patella, and then you keep going distally on the anterior aspect of your tibia, you'll run into a large bump, large bony projection, and this is the tibial tuberosity. So that quadriceps femoris tendon that we mentioned in the previous slide, as it engulfs the tendon, it then travels just distal to the tendon, and it attaches on this tibial tuberosity. So if you straighten out your leg and you extend the leg at the knee, if you slightly flex it, you should be able to feel that large tendon right below the kneecap. That is the patellar tendon, and that patellar tendon attaches to the tibial tuberosity. All right, if we continue on, you get the anterior crest. The anterior crest is just our shin, the anterior border of the tibia. And then you get the soleal line. This is where a muscle known as the soleus, which is one of our posterior compartment leg muscles, so along our calf region, it attaches along the soleal line and helps with plantar flexion of our foot. So it helps with pointing the toes downward. All right. Okay. Now, the second bone is the fibula. So this is not the fibia. It was never the fibia, nor will it ever be the fibia, but it is the fibula. So please say fibula. The tibia and the fibula form a joint both proximally and distally. All right. And these are joints that are relatively immobile. They can move a little bit, but not much. So we'll call these amphiarthrotic joints in the next lecture, which means slight movement. So you can move the joint a little bit, but not really enough to be able to tell that you're moving it, right? All right, so if we move just distal in the tibia, you get to something known as the fibular styloid process. Okay, this is where something known as the fibular collateral ligament, also known as the lateral collateral ligament, this is where it attaches onto the fibula. So it runs from the femur more proximally, and it stretches around the side of the knee, and it attaches to the fibula. So this is why it's called the fibular collateral, because it runs and attaches to the fibula, right? You also have the lateral malleolus. Okay, the lateral malleolus, and I didn't mention the medial malleolus with the tibia, but the medial malleolus of the tibia is this large projection that you see here. You can feel this very easy on your ankle. So if you run down your ankle, that big bony projection that you feel on the medial side, that is the medial malleolus. You go to the opposite side, the lateral side, and you feel the lateral malleolus there. Okay, you can have what are called malleolar fractures, in which you fracture one or sometimes both of these malleoli. So you fracture the medial malleolus as well as the lateral malleolus. Okay, so answer this question, pause the video, read it, answer it, and I will move on. So the patella articulates with which of the following bones? It articulates with the femur, right? So C. Okay, so now moving down into the foot region, we have a number of bones in the foot. Now, if you understand the layout of the hand that we did in a previous part of this lecture, you will also understand the layout of the foot because it's very similar. Now, the names of the bones are different and some of the numbers are different, but their general arrangement is similar. Okay, so in the hand we had carpals, metacarpals, and phalanges. In the foot we have tarsals, metatarsals, phalanges. Okay, so let's look at some of these. So this first tarsal bone is known as the talus, and this is what forms our talocrural joint with the tibia. So the term talo means talus, the term crural refers to leg, and it specifically refers to the tibia, and so the talocrural joint is the joint between the talus and the leg, or the talus and the tibia. Okay. All right, you also have the calcaneus. This is your heel bone. So if you have your shoes off, you can feel your heel bone. This is the calcaneus. You move just beyond that, you get to the cuneiform bones as well as the cuboid bone. All right, all of these bones form this interlocking connection, this interlocking network that we'll look in the next slide, that helps to form what are called our plantar arches. Okay, all right, you move beyond that and you get to your metatarsals. So just like in our hand where we had our metacarpals, we had 5, you also have 5 in the foot as well, right? So you have a head region, you have a midline shaft or the diaphysis, and then you have a proximal end way down here at the base. Okay, and then you move beyond that and you get your phalanges. In our hand we had 14 phalanges. The first digit, or our thumb, only had 2, a proximal and a distal. Same thing in our foot. We're going to have 14 phalanges. The first toe, known as the hallux, or the first toe, the first digit, only has 2. It has a proximal and a distal. The remaining 4, so the second, third, fourth, and fifth toes, have a proximal, middle, and distal phalanx. Okay, so the layout and the arrangement is relatively straightforward. Okay, so there's a neat mnemonic that will help you remember the names of the tarsal bones. Right, so these 7 bones that you see right here. Okay, so the bones that make up kind of our ankle region. All right, and this mnemonic is tiger cubs need milk, except you have to spell milk M-I-L-C. Right, so the T in tiger stands for talus. That's the first one that forms our talocrural joint with our tibia. The cub C is calcaneus. The N in need is navicular, that you see right here. So here's our navicular. And then the MILC, the milk, stands for medial, intermediate, lateral. So the MIL stands for medial, intermediate, lateral, and these are cuneiform bones. And then the C stands for cuboid. All right, so the C does not stand for cuneiform, but it's medial, intermediate, lateral cuneiform, and then the C stands for cuboid. All right, so use this mnemonic to help you remember the various bones of the tarsal region. Okay, all right. So lastly, what we'll finish up with here is talking about the various arches of the foot, right? So we've heard of arches. We've heard that some people have very archy arches, very archy feet. Some people have very flat feet. You may be flat-footed. And so we'll look at what makes this up. So you have an arrangement of bones in the tarsals as well as some of the metatarsals that form this interlocking kind of archway, right? So if you think of the formation of an arch, you have all these bricks, or you have all these stones that are placed next to each other, and they're also kind of moving in towards each other as well. So you have bones on this side, or in this case, you have rocks or stones on this side, and they're being stacked on top of each other, and they're slowly moving in toward this midline here. Okay, so you have ones here, and they slowly are stacking up on each other. You then have a single stone, and this is, you can learn this if you know something about masonry or architecture. You have a stone called a keystone, and the keystone is the one stone that helps to lock in place all of the other stones, and that's this one highlighted here in red. So you wedge this stone in, and it helps to block and lock in all of the other stones from falling in. Okay, you see the same thing in this image here, except this is showing the lowering in of a keystone. So here you have all these stones that are being supported by this infrastructure here, this scaffolding. You have the same thing over here. And then as you lower in this keystone that's cut to the exact shape of this space, as that locks in, you would be able to remove the scaffolding or the supporting, and you'd be able to have the archway, and it would really be able to stand on its own, okay, without the use of any other um, uh, cement or any other type of bonding material, right? So if we look at our foot, we see similar things, okay? So we have various arches. So we have two longitudinal arches that run the length of the foot, and then you have one known as the transverse arch that runs transversely across the foot, all right? This lateral arch is very low to the ground, and this medial arch is very high to the very high, so it's far away from the ground, all right? So you can see how these bones here form this interlocking pattern as they run from one to the next. And so you see the same thing here. So depending on what arch you're talking about, you have different keystones, right? So in this case, the keystone is one of the tarsals. It's one of the bones itself, okay? So for our medial longitudinal arch on the medial aspect of the foot, the talus is going to be the keystone, right? So this large bone that you see right here, this is going to be our talus. For the lateral longitudinal arch, it's going to be the cuboid. So it's going to be this bone this bone right here on our lateral arch. So this is the lateral arch here. Here's the cuboid, and that is the keystone there, right? And then you have a transverse arch which runs transversely across, okay? So you can tell that the different arches are arranged in different ways based on footprints, right? So whenever you're walking on concrete or sidewalk or something, when your feet are wet, you can see that so this is the medial aspect here, because here's our large toe, here's the second, third, fourth, and fifth. You can see on this medial aspect, there's no water, right? You don't see an imprint. And this is because the medial longitudinal arch is the highest arch, okay? It is up the most, okay? It's furthest away from the ground. Whereas if you look on the lateral side, you can see that water, in this case of the footprint, is all along the ground because the lateral arch is very close to the ground. So whenever you step and you press the foot down into the ground and you press the sole of the foot down, you get this impression on the ground, okay? Now, you can have different types of arches, right? So one is a normal arch, okay? And then you can have a very high arch, and we're talking specifically about some of the longitudinal arches, but it could also somewhat apply to the transverse arch as well. So you can have a very high arch, or you can have a very low arch, or almost no arch, right? So if it is a high arch, it's known as pes cavus. Pes refers to foot, and this one is forming this large cave or this large concavity as a result of this increased arch, okay? And then you can have very flat feet or flat foot, which is called pes planus, which is a straight plane in which the foot is all the way flat on the ground. Okay, so normal, excessively arched, or minimally arched, or excessively flat. So you can see the various impressions that these types of feet would make on if they were wet or if you did it on an ink pad. So in the middle is normal, so this is normal feet. Here you have an extremely archy foot, so you're lacking some of this lateral arch as well as all of the medial, right? And then on a flat foot, you have almost the whole impression of the foot down because you have very little to no arch on the plantar surface of the foot, right? And so what are all these what does all this mean? Who cares about arches, right? Well, it turns out that arches are good for a couple of reasons, and primarily two. One is weight bearing. And so as we have our body weight and we're pushing down on the on the femur, and that femur distributes weight onto the tibia. The tibia then distributes weight down into the foot, right? And so the tibia distributes weight onto the talus. The talus then distributes weight out to the calcaneus and the navicular, and then ultimately out through the other tarsal bones, and then out to the metatarsals, right? So these arches help to distribute the weight a little bit, okay? They also help with movement, right? So weight bearing is one. They also help with movement. So on the bottom surface of the foot, it's not just bone. There are tons of things on the under surface of the foot. There's fat, there are muscles, but there are also very important ligaments, very important connective tissue structures. One in particular is called the plantar aponeurosis. One is called the spring ligament. And what these do is they have a degree of elasticity to them. And so they're able to become compressed and stretched out, right? So they're able to be distended and stretched out whenever you put weight on your foot. So during the gait cycle, right, during moving, during walking, you move one foot forward and you step on your foot, right? You don't step on your foot, but you place your foot flat on the ground, right? When you do that, you stretch out some of those ligaments on the underside and you distend them. Okay, so those ligaments stretch out, they distend, and they allow you to absorb the weight, or they allow for the absorption of the weight that's coming down. Okay, then during the next phase of the gait cycle, in which you're swinging, you're picking up your foot, the release of some of the pressure and the release of some of the weight that's on the foot allows those ligaments to spring back to place, to kind of recoil back to their original shape, helps to restore the arch of the foot, and this helps to slightly propel the foot forward off the ground as you move forward. All right. So the arches aren't just something to confuse you or this kind of random anatomy, anatomical feature of the body, but they actually serve a relatively important purpose. All right. So we will end there. So this is the end of our lecture. This is the end of chapter 6. If you have any questions at all, please email me. And if you have none, I will see you in the next video.